Hello, this is the Coconino County Employee Benefits presentation. This is Tasha Smith with the county's Human Resources Office, and I am the benefits specialist. Welcome. The Coconino County's Employee Benefits runs from July 1st through June 30th of every year. It has a fiscal year calendar, and we are part of the Northern Arizona Public Employees Benefit Trust, known as NAPEBT. With NAPEBT, it's a group of public employers who are fully self-insured with respect to medical insurance. And here's a listing of the public employees that are a part of that trust: City of Flagstaff, Coconino County, Coconino Accommodation Schools, Coconino Community College, Flagstaff Unified School District, and the Northern Arizona Intergovernmental Public Transit Authority, which is known as NAPTA. And they operate the Mountain Line bus system here in town. Alright, so here's the benefits overview. I just want to make sure that you are a regular status employee working at least 30 hours per week, or you're a temporary employee who was advised by Human Resources that you are benefits eligible due to the Affordable Care Act eligibility. Generally speaking, benefits are effective the first of the month following a full month of employment. If, say, you were hired April 23rd, your benefits would be effective June 1st. The waiting period for benefits is waived if you are a benefits eligible employee with Coconino County within the previous 12 months or rehired to the county, or you are coming from one of the other NAPEBT employers within the previous 31 days. And say that does apply to you, please make sure that Human Resources knows that that is applicable to you. And in the example here, there is a minor error. So if you were hired, say, hypothetically June 4th, your benefits will actually be effective July 1st, 2018. Alright, so once you make your benefit elections, they are pretty much set in stone. You really can't change it throughout the plan year unless, first off, we have open enrollment every year, which is typically about the first 2 weeks of May. So this next upcoming open enrollment is until April 29th to about May 13th, 2019. Any changes that you submit during that time frame will be effective July 1st. Otherwise, your other opportunity to make benefit election changes would be due to a qualifying life event, and typically within 31 days of that. And the most common qualifying life event examples, QLEs, are marriage, divorce, birth, adoption, loss of other group health coverage. If you do experience this, you will need to report it to the online benefits center at napepbenefits.com. I'll go into more detail of how to gain access to that shortly, but those are typically your windows. Alright, so the online benefits center, napepbenefits.com/county. This is where you will make your benefit elections, submit your benefit elections electronically. This is where all of your benefits information is housed. So I would advise you to please log in and at least make sure that the information there is accurate. So with this, at this location, your login is the first initial of your first name, your full last name, followed by your last 4 of your social security number. That's your login ID, and your initial password is the last 6 of your social, and then you'll be asked to reset that after you initially log in. Like I said before, you can view all of your current benefit elections at any time here, including medical, dental, basic life, and voluntary life, FSAs, HSAs, and if you have short-term disability. And you can make changes to your benefit elections during open enrollment and to report a qualifying life event through this website. If we are not available here at Human Resources, please call the benefit specialist at 800-307-0230. They are available Monday through Friday, 8:30 a.m. to 5:30 p.m. Eastern Standard Time. And they have more coverage during open enrollment. So, all new hires are set up with the default benefit elections when they are hired with Coconino County. These default elections translates to medical, employee-only, high-deductible health plan with no employer contribution to an HSA or FSA. Since we don't know which account you qualify for, you're just not set up with that, okay? For dental, that means employee single base. For vision, that means employee-only core plan. Typically, these are the free plans. It doesn't cost employees out of pocket to be on these plans, so hence why they are the default benefit elections. You will be given a 2-week window to submit your benefit elections. If after that 2-week window you don't submit your benefit elections, the default benefit elections that I just mentioned will remain. Again, here's your login ID, first initial of your first name, your full last name, and then the last 4 of your social security number, and your initial password is the last 6 of your social security number. So here, if you can just look at your date to hire, that will give you an estimate of when the online benefit center will open and when it will close for you. We'd just like to go over some of the trust search trends and history with respect to the medical insurance. And here, this graph depicts the number of large claims the trust has experienced. And a large claim is something that pierces the $100,000 mark. And the end of June 2017, we had 22 of those claims. And in the prior fiscal year, we had 25. And then back in 2012, when we ended that fiscal year, we had a high of 30. So just like an automobile insurance policy, the more accidents you have, the more serious they are, the more expensive the claim becomes or the policy becomes, the medical insurance rate becomes. So we would like to see these numbers decline, not necessarily incline. Here's another depiction of the net claims per month per employee, and is another depiction of the medical insurance and how much it's costing. At the end of fiscal year 17, it peaked at about $593 claims per employee per month, and it's kind of on the downswing, which is a little bit good. So again, just another depiction of that. An overview of our benefits. Some of the key benefits are offered at Coconino County. Medical insurance is through Blue Cross Blue Shield of Arizona. Pharmacy prescription is through CVS Caremark. It is not through Blue Cross Blue Shield, so please remember that. Dental is through Delta Dental of Arizona. Vision is through VSP. Basic term life and voluntary term life is through Minnesota Life or Securian Life. And then long-term disability benefits are embedded within the state retirement systems. Vacation leave, if you are full-time, you will start accruing at 4 hours per pay period. Paid sick time, you'll be front-loaded with 40 hours of that. And then you'll be set up with another accrual titled paid time off, and you'll be accruing 2.15 hours per pay period. And this is a sick leave bank. I know what some of you are coming from the private sector, PTO kind of translates to vacation leave, but here at Coconino County, that's actually a sick leave bank, okay? There's a unique program here at the county called Volunteer Time Off. There is some eligibility criterions you have to meet to get this accrual on your setup, but what it does is it encourages our employees to volunteer back in the community, whether it's at their child's school or there's a list of locations that are currently approved for this volunteer time off. And if you're full-time, you can volunteer up to 16 hours per fiscal year. EcoPass, if you are interested, there is a free bus pass available for the Mountain Line bus system. Please see the HR receptionist at time of your new employee orientation to inquire about this and to get one assigned to you if you do want one. Employee assistance program, and we will be offering that. Right now we are in a transition, so that provider will be identified shortly. Wellness program, we have a wellness program through the NAPEP overarching group, and then we have one here at the county, and it's more with the safety committee, so the safety and wellness committee here at the county. Both committees do work to promote wellness. And if you are interested in serving on the county safety and wellness committee, please contact Human Resources and let us know. We're always looking for members to help us out there. Sick leave conversion, this program is unique here at the county. After 5 years of continuous service, you may be eligible to convert some of your sick leave to your vacation leave bank. That's pretty cool because at time of separation, vacation leave is paid out, not necessarily sick leave. And then with the leave sharing program, another program unique here at the county, for those employees that are on an approved leave of absence and they exhaust all of their leave accruals, sometimes they ask for leave donations from fellow county employees. And these lists are maintained in the SharePoint website under the HR tab. So if there's anyone out there, it will be on SharePoint. A personal day purchase, another program unique here at the county. This was kind of born out of the recession of 2008-2009, where we gave the option back to the employees if they wanted to buy additional days off and pay for that at the hourly rate. And the maximum that they could buy is 10 days. And this program was very popular that to this day we have difficulty spinning it off. And it may be good for someone who is needing some time off within the first 6 months of employment, because you cannot use vacation leave for the first 6 months. So you definitely have to have a dialogue with your supervisor to get that approved and such, but there's an option for you. Tuition reimbursement, another invaluable benefit here at the county. Again, there's some criterions that you'll have to meet to be able to partake in this, but essentially for those who return to school and are seeking a program of study that is approved by the county, they may be eligible to get some monies reimbursed partially at the end of each semester that they complete classes. And there has been huge success stories out of this program. Employees have graduated from their programs of study, and it's really great to see. There again, if you have questions about that, please contact Human Resources. Our medical plans are through Blue Cross Blue Shield of Arizona, and then our prescription plans are through CVS Caremark of Arizona. Here is a depiction of the 3 medical plans that are offered by Coconino County. We have a base plan, we have a buy-up plan, and then we have a high deductible health plan. For fiscal year 19, there was an increase to the medical out-of-pocket maximum under each of the plans, as well as the retail copay for generic prescriptions under the base and the buy-up plan are now $8 per fill, when it was formerly $5. If we go through the base plan together, under the base plan it's $1,000 employee deductible, $2,000 if you add your family. Primary care physician copay is $40. I just want to mention here that if you do use the Vera Hold Health Clinic instead of going to your PCP for a sick visit, you could save on this $40 copay, because being on the base of the buy-up plan, utilizing the Vera Hold Health Clinic, typically any services that you render there will be free of charge. And I'll talk about the Verihold Health Clinic a little bit later. The specialist and chiropractic copays are $50 each. Urgent care copay $80. Emergency room access fee is $200, and the inpatient hospital admin fee is $100. If you are admitted into the hospital based on an ER visit, the $200 fee will be waived, and you will be assessed a $100 fee. Member co-insurance is 20% after you meet the deductible, and the deductible resets every January 1st on a calendar year basis. The medical out-of-pocket maximum under the base plan is $4,750 per employee, $9,500 per family. Prescription copay for the generic is $8, for the formulary is $35, non-formulary $45, and the specialty drug copay is $65. And these are for a 30-day fill. You can save on half a copay or a full copay if you participate in the 90-day fill program through the pharmacy or through the mail. And there is a separate prescription out-of-pocket maximum, $2,350 per employee, $4,700 per family. And once you go outside of the network, you will experience a higher deductible and a higher co-insurance after you meet that deductible. So typically the buyout plan, you are looking at a lower deductible, and the copays are about $10 less for the most part. But the prescription benefit will remain the same. And the high deductible health plan, you're looking at a high deductible and $1,750 per employee, $3,500 per family. And there's no copay structure, but instead you'll be paying 80% of the negotiated rate till you meet the deductible, and then your co-insurance is 20% after that. Prescriptions under the high deductible health plan will vary. If you are really interested in this high deductible health plan and you do have a prescription, I am more than willing to get an estimated cost of such prescriptions because it does vary. So again, if you do have questions about that, jot down a note, send me an email. And under the high deductible health plan, the medical out-of-pocket maximum and the prescription out-of-pocket maximums are combined. So $5,000 per employee, $10,000 per family. And here are the costs. So for fiscal year 19, we are experiencing a 9.5% rate increase on the rates for these plans. For the base plan, single employee only is $20 per month. If you want to add your family to the base plan, whether you have 1 dependent or 10 dependents, it's going to be that same rate, $434.26 per month. Under the buyout plan, remember here you will be experiencing a lower deductible and the copays are a little bit less. For employee only, it's $84.58 per month. For family coverage under the buyout plan, it's $597.98 per month. With the high deductible health plan, for employee only, there is a savings. So it is free. It does not cost the employee anything. If you look at this rate table, the county is contributing $601.34 on your behalf, but it's only costing $551.38. So the difference between these two numbers is $49.96. So that money will be given back to the employee as a form of an employer contribution to your HSA or FSA, whichever account you qualify for. And if your benefits begin later in the plan year, it will be prorated for the remaining months. So $49.96 per month. To get the insurance for a family plan under the high deductible health plan, it's $306.74 per month. Plan design changes for fiscal year 19. We are experiencing increased the generic copay for prescriptions to $8. There will be coverage for alternative medicine, namely acupuncture and homeopath naturopath. So for acupuncture, it's a $500 annual maximum. In and out of network, co-insurance and deductibles apply. Homeopath, it's the copay plus any of the difference between billed, charge, and allowed amount. So it's applicable to copay, deductible, co-insurance paid at allowed amount. External hearing aids will also be covered. 1 exam per calendar year. Under the base and buy-up, it's a $15 copay for an in-network ear exam. Under the high deductible health plan, the deductible and co-insurance will apply. The plan will pay a maximum of $2,500 for every 3 years. So at the Online Benefit Center, there are benefit plan change summaries available, and there's a lot of information there. Some useful information for medical insurance. Deductibles reset every January on a calendar year basis. We do dual spouse deductible coordination for those husband and wife who are employed by the NAPEP employers, one of the NAPEP employers, and one of the spouse has coverage under the family plan. Flu shots are covered at 100% if you go to your doctor's office just for the flu shot, or if you go to the Vera Holt Health Clinic. And under the wellness program, this is worth 4 points each, as it's recognized as a preventative screening. You will get separate member ID cards from Blue Cross Blue Shield and CVS Caremark. Please keep them with you at all times. I often have employees taking their Blue Cross through to the pharmacy trying to fill a script, and they're calling me telling me that they don't have benefits under there, which is accurate. Here again, just a reminder that the benefit plan change summaries are available on the Online Benefit Center. And you have the option to waive the medical insurance offer from the county, provided that you complete the form and provide proof of other qualified coverage. And it is qualified group health coverage that is not through another NAPEP employer. If you're on Medicare, qualified public health plans such as Access, Indian Health Service, or TRICARE. And then just to let you know that the Marketplace does not qualify as a group health plan. And then we purchased carved out benefits to where on all 3 plans you have access to the Mayo Clinic in Arizona and a couple campuses of the Cancer Treatment Centers of America.